Hi, I'm Dr. Jody Mullen. I'm a counselor, educator, and play therapist and mental health counselor with 3 decades of experience in those fields. What I want to talk to you today about, do you have a minute? Because it's not going to take very long, but it's really important. And it has to do with setting limits in play therapy. And there are a whole bunch of different sort of protocols and ways to set limits in the play therapy room. I just want to talk about a bit of nuance for this. I really do think that limit setting depends, one, on the theoretical approach that you're anchored to in the playroom, two, you, three, the setting, four, the child. And with all of those things being taken into consideration, is there's some nuance to this. So one of the things that I think is going to help you with I actually think the most difficult skill in play therapy, limit setting, is if it makes you nervous, set the limit. Okay, now that might sound really simplistic, but here's the thing. If you're feeling nervous about a child standing on a chair, about a child throwing a ball, about a child dumping a whole bunch of things out, you have to set the limit. And here's why. Because once you're nervous, you're becoming dysregulated. You're becoming pulled off your center. You're not able to attune to that child anymore. And so that means that I probably wouldn't set a limit for a child standing on a chair. It's not a wet, wobbly chair. It's not a wet, wobbly child. I'm good with it. I probably wouldn't set a limit for a child creating a mess in the playroom. Kind of depends on the setting that I'm in. Am I school based? Do I have somebody coming in right after? How big is the mess? Is it a wet mess, a dry mess? These are the nuances of it. But when it comes down to it, if you are feeling uncomfortable, if you are feeling nervous, if you are feeling pulled off your center, that is a litmus test for you. You need to set the limit in the moment so that you can remain attuned to the child. And then bring it up in supervision. So you can sort out with your clinical supervisor the why of getting nervous, the why of being pulled off your center, the why of the necessity to set that limit. So just something to think about as you start to or contemplate the nuances of the art of play therapy.